But we're also fortunate to have so many great things, great services for people in the region. And since 1882, Children's Home of Northern Kentucky has been a premier provider of behavioral health and substance abuse treatment services.
Now, to tell us more about the services, we want to welcome Chief Executive Officer Rick Wurth and Chief Programming Officer Crystal Leugers. Thanks to both of you for being here today.
Thank you so
Yes.
much.
Good morning.
And I know the first thing I wanted to, this was a pretty staggering statistic. It's estimated about 3.2 million Kentuckians live in a community that lacks enough mental health professionals. How is Children's Home in Northern Kentucky sort of helping to bring that number down?
Yes, absolutely. And you know, the other piece of that equation is, of course, even in areas where there are enough mental health professionals, there are a number of providers that don't accept the Medicaid card. And so one of the ways that CHNK really is working to be instrumental in addressing those barriers is, of course, accepting all forms of payment. So Medicaid, commercial insurance, self-pay. One of the ways that we've really attempted to pivot quickly in addressing those needs is that since the pandemic began, we've actually offered 10,000 telehealth services.
Oh, good.
So we're really meeting people where they are. We also offer services within the school, actually in-home services, and then at our 3 campus locations in Northern Kentucky.
So you really do A to Z services. Tell us more about the services that you offer. I love the telehealth because that's what a lot of people use these days.
Absolutely. Thank you for asking that, because I love that question, because we do have really strong roots as a residential facility. We started out as an orphanage, and we still have psychiatric residential both for boys and for girls. But in the last couple years, we've really expanded our outpatient services, and we provide services to all age ranges. So early childhood, older adults, at all different levels of care. So people who need really intensive services or individual services just for an hour a week. But we also have medication management, and that's something that we're really proud to offer in the last couple of years because it's such a barrier for people to be able to get in.
You're right.
Speaking of barriers, I think maybe one thing that's significant for Children's Home of Northern Kentucky is that we're a partner with the National Human Rights Campaign Foundation with one of our programs entitled All Children, All Families, because there's a disproportionate number of LGBTQ youth who have a hard time addressing mental health needs, and sometimes that particular population faces more barriers than their peers. And so we are the only provider in the Commonwealth of Kentucky with the highest level of certification called Innovator Status from the National HRC Foundation because of our culturally competent work with LGBTQ youth and families.
It's wonderful. Yeah.
Well, tell us about your campaign, An Easier Path to Mental Health. What does that entail?
It entails us addressing community needs that are ever increasing since the pandemic. Before the pandemic, we had problems in Kentucky with finding enough healthcare providers to meet the needs of young people, of families. That's only gotten worse during the pandemic. And we're ready to do something about it. We do not want young people, we don't want children, we don't want families on waiting lists. And the way we're going to address that is by launching a $38 million expansion project. It'll be the largest expansion project in our 141-year history. And we're confident we can do it. We have the support of the community, we have the support of our elected officials, and we're excited about the fact that what that will translate into is almost an additional 4,000 kids and family members receiving services every year. We're estimating that about 3,600 more kids will be served at one of our 3 locations or in our schools, at our in-home services. So we're quite excited about an easier path to mental health.
This is so good to hear, and it's so good to hear the passion and commitment you have for this because it is so needed out there. Tell us, how can we support your mission? If somebody out there is watching right now, how can they support?
Pete, Michelle, thanks for that question, because there's literally a million ways people can get involved. This Children's Home of Northern Kentucky literally started because of regular folks, men and women in the business community, men and women in the faith community, who decided we might not be able to do everything as human beings to address folks in need, but we can do something. And on that note, there are all kinds of ways to get involved. We have a new community board that's just starting at Children's Home of Northern Kentucky. You can check out information on our website at CHNK, children'shomenorthernkentucky.org, about joining that new community board. You can also help us with expanding our profile and helping people to know about our work. So many people think that we're only an orphanage from the 1800s. They don't know that we're a mental health care provider for the general public. And so some people might want to jump on their social media apps and like us, friend us. You can also contact, if you're living in Kentucky, contact your locally elected officials and let them know that you support the work that Children's Home is doing in northern Kentucky and throughout the Commonwealth.
And I know we have the phone number right there, the website, where you're located. This is awesome.
Thank you.
Thank you so much.
Yeah, Rick and Crystal, we really appreciate it. Like you said, just making people aware. Hopefully we did that today.
Yeah.
So
Absolutely.
we appreciate you being here.
Thanks so much.
Thank you.